Hello, everybody. This is my first time doing a Zoom meeting. I'm always gun shy about internet videotaping, but we're going to do Zoom, but also we're going to videotape this. What just came back from last week at Medicine Week at Baden-Baden. So my topic will be parasite, fungal, dental infection, and cancer. I did give two lectures back to back. First one was on international group for English speaking. And second talk was on German Integrative Oncology Society. And anyway, so I'm talking about unconventional diagnostic and therapies. So bear with me. I'll try to go a little bit slower than when I gave it in Germany. So we'll have a little more have time to also discuss later on. So I personally do not treat cancer. I treat the whole body. I think it's an important emphasis. And we are getting into what I call energy medicine. My objective is looking for a simple solution for complex problems and recognize that parasite, fungal, and dentals are often overlooked cause of medical problems, including cancer. And there is introducing a new way of detecting parasite, fungal, and dental problem, using improved technology to access Acupuncture Meridian Assessment, which is sometimes called EAB or Acupuncture Meridian Assessment. And learn new approach of cancer therapy using parasite medication, and IPT. IPT stands for insulin potentiation therapy to block cancer metabolism. And this is based on evidence-based medicine, power of N/1 on individual case studies. I'd like to start with this article we published some years ago, 2019, with Dr. Guilford and I. It's called Anti-Parasitic and Anti-Fungal Medication for Targeting Cancer Cells, Literature Review and Case Studies. And basically, we're bringing up the issue that is it possible that treating cancer as an infectious disease? Is cancer as a metabolic disease with a tumor growing and metastasis spreading like a metabolic parasite? It may sound a little bit far-fetched, but there's a more overwhelming evidence maybe cancer is an infectious disease. And there will new way of looking at the cancer therapies. And in this paper, we have about 46 references on how to use parasite medication. Now, if you look at the background, it's a very complex biochemical, metabolic, and immune pathway. And I'm trying to, is there any way we can simplify this based on Acupuncture Meridian Assessment? And there is a called Where is W anti-signaling pathway? In case you are not familiar with the W anti-signaling pathway, this is one of the holy grail for anti-aging, for chronic disease, and for cancer therapy. So where is W anti-signaling pathway in this complex metabolic pathway? In reality, I have no idea, but there's a simpler way to regulate W anti-signaling pathway. So if you look at this, it says a key to regulating W anti-signaling pathway. What does W anti-signaling pathway does? They are controlling the embryonic stem cells for differentiation and proliferation, involving migration, metastasis. They control so many chronic diseases, whether they have a lung, heart, hair disorder, liver, osteoporosis, arthritis, cancer, all the neurologic problem or autoimmune disease. People are spending millions of dollars to how to regulate W anti-signaling pathway. This is considered billion-dollar next big boss for the medication. But if you look at the graph, on the graph on top of the right side, it says niclosamide can regulate W anti-signaling pathway. The niclosamide is one of the well-known parasite medication. So I'm going to take you for the next 45 minutes how parasite upregulate WNT regulation and how parasite medication may downregulate WNT signaling regulations. So just in case running out of time, I start with the parasite-fungal medications, how to target cancer cells. So first top 4 is ivermectin, mebendazole, praziquantel, and niclosamide. That's a classic parasite medication. And the middle is azithromycin, tanadazole, and nystatin. Often I use that for dental infections. Tanadazole or metronidazole, that's for actually dental entamoeba denticola. Followed by doxycycline, and that's also good for intracellular parasite, and fluconazole and itraconazole as a deep fungal medication. And sometimes I will use 3-bromopyruvate. I'll go over those again, re-emphasize how to use parasite medication. So what I do, I usually explain to my patient, it's like inspecting the human body, like a violin with a musical scale based on Acupuncture Meridian System. The scale is 0 to 100. Midpoint 50 is considered balanced, and 45 to 55 is considered normal, acceptable range. The actual scale is 0 to 600,000 ohms. So we're going to start with the first case. 52-year-old Air Force colonel from White House came to see me. I saw him first time the year 2009, and I'm reviewing his medical record, military medical record. He's got irritable bowel syndrome, severe fatigue, chronic diarrhea, lumbago, low back pain, fever of unknown origin, esophageal reflux, chronic sinusitis, allergic rhinitis, vestibular neuronitis, dizziness, sleep apnea, insomnia, headache, and empty sella syndrome. For me as an internist, I don't know what to do with these kind of patients. They do every known test, you send to every known specialist, but what I do is translate his problem into Meridian system that makes some sense out of this. So when I check, so many of these acupuncturists, they don't actually measure the actual Meridian system. Now we can measure actual Meridian system. So when you're looking at the graph, green means within normal range, within 45 to 55, scale of 0 to 100. Blue means too low, red means too high. There's no red, it's a chronic condition. He had been sick for many years. And he's got 17 out of 40 meridians are out of balance. And this is what I call, he's in precancerous stage based on his meridian system. He's got problem in spleen, liver, gallbladder meridian, and major organ system, including large intestinal and small intestinal meridian. Among the 17 meridians, we have to figure out which meridian is the most dominant problem. In this case, it's a small intestinal meridian, gallbladder meridian, and large intestinal meridian are the 3 dominant problems out of the 17 meridian system. And in his case, adiprimone, parasite medication, ivermectin, and tanadazole, and there's a dramatic response with a couple of cycles of parasite medication. So you have to learn how to read this like a musical scale based on the meridian system. So look at this fine balance in immune system, inflammation, infection, and immune dysregulation, the role of chemokines in parasite infections. Whether you have ARS, Alzheimer's, asthma, or some pneumonia, seizures, Weir syndrome, cancer, chronic fatigue syndrome, what are the missing links? You can measure Th1, Th17, Th2, Treg, but which direction they are going, can we predict that? I think we can do that by understanding the meridian system. That's what I call the 7th sense. Now, dental is one of the key driving force why people are getting well. We're going to go through some of the case studies. So I do have my own dental x-ray to measure right away, give you immediate feedback on my patient, what's going on. Now, things I do is based on electroacupuncture according to Dr. Voll from Germany, very popular in 1960s and 1970s, and even early part of 1980s. But it's been fading away because it's too complicated. It takes so much time to do classical EAB based on homeopathic principle. I personally have a hard time following the whole EAB principle, which is based on homeopathic principle. And eventually, I have to adapt to fit into my need as an internist. And when I came back from Bolivia, year 2001, I started using parasite medication. It changed the whole outlook of looking at how fast I can rebalance the meridian system based on parasite medication. And I've been writing about this whole phenomenon, and I call it accidental cure. So this is the actual scale is 0 to 600,000 ohms at the acupuncture point. We're just simplifying the scale to 0 to 100. And be within range of 45 to 55. Ideal is at 50. We measure all those points. Some of them are classic Chinese acupuncture point. Some of them are based on German electroacupuncture according to Dr. Voll. We don't have time to go through all the points, but just give you some idea on your hand for main 20 points on right and left hand, and on your feet for another 10 points for total 40 main acupuncture point. Actually, I check about 50 points. Some of them are within same meridian system. I document only major problem within that meridian system. So this is what I call tuning the violin for symphony of life as a single point, duet, quartet, and symphony of life with a 40 meridian as a system. So I'm looking for the pattern recognitions. And this particular patient have a Lyme, 39-year-old female with a chronic fatigue, Lyme, whole list of the problem that nobody knows what to do with these patients. And I'm just checking what the problem is. So again, green means within normal range, blue means too low, red means more in inflammatory state. And based on those readings, I put on triple parasite medication. And she's a nurse, and she have a dramatic response. And what she didn't tell me is that she have a 5-year-old severe autistic child, and she gave her parasite medication to a 5-year-old severe autistic child. And within a few weeks, he started talking. And that just gives the perspective, the degree of the underlying problem. We don't simply appreciate the impact of the using parasite medication. And one of the things I'm pointing out in the beginning is that maybe it's parasite medication not only going after the parasite, but it may have effects on W-anti signaling pathway for downregulation or upregulation. So in this patient, I'm reading that meridian as a musical scale and give you a recommendation based on those which I do training for physicians. So in this case, it's a 47-year-old nurse with a rheumatoid arthritis. She also has a history of some dental problems. She didn't know she has it. And she was a routine exam on her right breast. If you look at it, which you will be looking at from your, actually, on the left side will be on your right breast. TH4, that means thermal heat score of 120. This patient about to have a full-blown breast cancer. And dental work is done, pull the bad tooth out, parasite cleansing, and you look at the change from TH4 to TH3 and TH2. By the time it's a TH2, means it's become fairly benign. It took few years. It happened about 2.5, 3 years. It didn't happen overnight. It's a process you have to go through it. And her also rheumatoid arthritis went away, and thermography is improving, you can visualize that. Here's a 72-year-old man from Miami, no energy, delayed ejaculation. His wife is a physician, and I'm just reading, just mapping up. I have no idea, what do you do with the delayed ejaculation? But when I check, 19 out of 40 meridians are out of balance. With his age, I know he's a high risk for developing cancer. It's just a matter of time. And based on the meridian test, I did put him on Ivermectin, mebendazole, praziquantel, wormwood, followed by nystatin, fluconazole, itraconazole for 6 cycles. His cardiac C-reactive protein was over 100, and anything above 3 is considered too high. In cancer profile indicating PHI is called phosphohexoisomerase, is one of the markers I use for cancer patients at 99.1. And anything above 31 is considered too high. And this patient have a cancer spreading right now. We don't know how it's going to manifest as a lung cancer or prostate cancer, but it's brewing, about to be full-blown cancer. After the 1 cycle of a parasite and fungal medication, his C-reactive protein dropped down to 3.73 from over 100. And his chronic cough went away. He never complained about the chronic cough because it's so chronic. He never thought about it complaining it. And also his PHI cancer profile dropped down to 38 with a 2 cycle of a parasite medication. So the point I'm making here is that we can predict pre-cancer stage, and we can prevent based on the meridian system, and aggressively using parasite medication and dental work to be done. Here's a 46-year-old white female with a multiple myeloma, had a radiation. I saw 2012. Lump in the neck for 1 year, ear, nose, and throat evaluated as a plasmacytoma of nasopharynx, eventually diagnosed with a multiple myeloma. She had a radiation, chemo, and still positive PET scan, met the multiple bone lesions, 4 fractured bone, biopsy persistent for cancer of the multiple myeloma with an increase in bone pain. Prognosis for this patient is almost nil. They suffer from severe pain and eventually die less than a year. Physical exam, unremarkable. 20 out of 40 meridians are out of balance. Put on ivermectin, parental palm oil, praziquantel, artemisinin, IV vitamin C, IV ozone, UV therapy, dental referral for oral surgeon, and refer to holistic oncologist, and more anti-fungal medication. So there's a change from before and after parasite medication. From the top to the bottom, there's a the 3 of those blue is dental-related problem. I cannot fix it. They have to be done by dentists. If you don't correct the dental problem, most people don't get well. So we have to push my patient to get make dental work to be done. First thing I noticed on what I circle in the circle is a number 6 in all wisdom tooth area that's been cleaned out. During the several years, you have to get multiple dental work to be done. It's not just a 1 single visit. It's a multiple visit to the dentist and find the right dentist, get a dental work to be done. Almost all my patients, I do not only hair mineral analysis, allergy tests to be done before I give a dietary guideline. And she's highly allergic to peanut, and peanut has been associated with aflatoxin, fungal mycotoxin, carcinogenic, and soy, one of the most genetically modified crop. They're all interconnected while creating an allergic response. Most cancer patients I look for heavy metals, and she have a high in lead and mercury. She originally came from Michigan with a known lead, the contaminated area nearby. And so it's no surprise when you see lead and mercury, they're 100 times more toxic than just individual heavy metal toxicity. And she also have some tungsten. Now, This is called free copper light chain. This is one of the markers we use for multiple myeloma. I refer to holistic oncologists. They use different chemotherapy. And this free copper light chain is coming down and start going back up. And basically, he says, stop. It's you need to be in a hospice. It's not responding. And then that's when I used first time insulin potentiation therapy. And after 40 IPT, the level coming back to normal, but we stopped, it's rising, we have to go to multiple additional IPT to be done. But 12 years later, she's cancer-free, pain-free, feeling great. I saw actually last week, coming back from Baden-Baden, she was on a vacation in Italy, and she said, her friends are getting old. Now she's approaching not 12 years, like approaching 60 years old, and her friends are getting sick, and she said, I feel great. So if you correct the underlying problem, we can avoid all the side effects, and they can still thrive 12 years later. So insulin potentiation therapy, I use antiviral, antibacterial, antifungal, antiprotozoal medications with insulin, developed in 1932. Cancer cells are 6 times have 6 times the insulin receptors and 10 times more IGF receptors in the cancer cells than normal cells. We use IPT as a delivery system to target the weakness of glucose metabolism of cancer cells, developed by Dr. Garcia from Mexico. But we never give him enough credit for the sort of simple technique to deliver to cancer cells. Here's another case. 52-year-old Boeing engineer with a history of ulcerative colitis. He got well with the parasite medication, but he had this annoying pus draining in his right thumb, and then eventually turning into squamous cell cancer. And then whenever I see him, only thing I can pick up is a dental. And whenever I send to the dentist, they said nothing wrong with your dental problem based on CT scan, cone beam, every known test there is. But that's eventually, dental is the only one showing up. Go back and forth over a year and a half, 2 years. Now he's getting, oncologists recommending to amputation of his right thumb and maybe radiation and chemo. He got scared. So he basically told the dentist, go ahead and remove the tooth. Doctor used a number 11 to be removed. And he eventually removed the normal, but then the cancer coming back. And then there's another one, it's like a number 12 is getting bad. Then dentist refused to pull the tooth, but eventually we end up pulling the tooth. It's such a struggle for over a year and a half, 2 years. And one of the things I request was, at that time, it was about 8 years ago, to DNA test be done to see in that tooth what kind of microbes are in that tooth. It's like a checking for DNA forensic evidence. So there's a mark, you have to get actually 2 teeth out. When you have one rotten apple, it can spread to the next one. And it may look perfectly fine. And this is like a connection between large intestinal meridian and dental connection. People don't think about large intestine is connected with the tooth and whole organ system, including colorectal cancer. I'll see that many, many times. So in his case, we did a DNA test, and I don't know whether you can see it. In the bottom, it says cytomegalovirus, and then actinomyces, Enterobacter, Prevotella, entamoeba. Entamoeba is the Entamoeba denticola. It's a dental parasite. This entamoeba, dental infection like to go where the fat is. Either they like to go to the brain, or they like to go to the breast, or in between is the thyroid. So they can go anywhere, but there's a preference where they like to go, where the fat is, to the breast, to the brain, or to the thyroid. So many thyroid problems, thyroid cancer, Hashimoto's, autoimmune, often dental is part of the puzzle. So we need some better early warning system not only CT scan, PET scan, all those tests. We need some unconventional medical intelligence, and I'm using ancient intelligence called Acupuncture Meridian Assessment. So if you look at the cancer genome theory, that's the world, that's a genetic mutation is driving the force. But if you look at it, there's many years of this chronic inflammation and infection is actually driving effects on mitochondria and genetic mutation. Genetic mutation is at the end of the product, not the actual driving force for cancer development. So in between infection and inflammation, I like to point out there's a W anti-signaling pathway is one of the driving for either proliferation and for downregulation is based on W anti-signaling pathway. So if you look at the concept of homotoxicology, we have a dental, fungal, parasite. You may have those 10 years before and may develop breast cancer or prostate cancer, and they don't see that connection to it. If you just focus on dental, if you focus on parasite or fungal, you'll get disappointing response. You have to address all of them, including environmental toxin. So this is from Cell, talking about magazine, the scientific data called magazine called Cell, a pan-cancer analysis of the microbiome on metastatic cancer. And in the highlight from the abstract is a recent study shown that complex microbial communities are present within primary tumors. They've done over 4,000 metastatic tumor biopsies and organ-specific tropism of microbes, enrichment of anaerobic bacteria in hypoxic tumors. And they'll give you an example. Fusobacterium has been associated with the resistance to immune checkpoint blockade in lung cancer. And if you look at Fusobacterium, I do so many DNA tests for the dental infection. We'll see often Fusobacterium, and somebody have a colorectal cancer, prostate cancer, breast cancer, etc. So DNA tests can be very valuable information to look at what kind of microbes are in that dental infection, connection with the rest of the body. So if you believe in evolution, I believe in evolution and creation, but let's look at just evolution point of view. We have a universal ancestors with the DNA and RNA, where these are all evolved with our genome. And then there is a archaea, there's a bacteria, eukarya with a protozoa, and there is a plant, animal, fungi, Homo sapien, and there is a parasite. I put parasite at the top. They're the top of the food chain. Why not the top of the food chain? And then fungi as an undertaker. But there's another type I have to introduce to you. Again, take this my kind of my sense of humor. But anyway, if you look at it, this is what I call parasitic Homo sapiens. These are the billionaires who control our medical care, politics, and anyway, they are the one what I call parasitic Homo sapiens might be actually top of our food chain, and we have to be aware of what's going on here. Why do we have to pay those outrageous price for simple parasite medication? They profit from this, raising the parasite medication when you can get it for a fraction of the cost in another country. Well, let's look at multiple factors contributing to Lyme, post-Lyme, and cancer. We'll talk about parasites, because when I'm talking about parasites, I always talk about that, including fungi, bacteria, and virus. And then we have to look at environmental toxins, heavy metals, and nutritional imbalance and deficiency. Genetic may some play a role, probably a minor role, not a major role, with a cell signaling pathway. And then others, including social factors, dental, EMF, toxic emotion. They all play the role while we're getting sick. That has effects on metabolic dysfunction, mitochondrial effects, the mitochondrial damage and dysfunction. We can see that through the extracellular matrix through the meridian system. That's why I detect the change in meridian system. So whether you have a Lyme, post-Lyme, or post-COVID-19, eventually progress in chronic disease and cancer, and some of them might be driving is that all the complex biochemical pathway, including WNT signaling pathway. We talk about pesticide, insecticide, herbicide, benzene, organophosphate. They're also driving the environmental toxin, why we're going to more pathologic conditions. And for me, I started year 2001. That's when I first time used parasite medication. Before that, even your suspicion of the parasite sent to the soil for a parasite, nothing sure. So I assume like everybody else, we don't have a parasite problem. But when I came back from Bolivia, that's when I was using parasite medication, mebendazole and parental palmoate. So many problems goes away, whether you have asthma, MS, cancer patient, chronic fatigue, fibromyalgia, Lyme, they respond better. But I couldn't claim, there's no proof, because when you check for parasite, they don't say there is any parasite problem. So I've been calling this whole phenomenon as an accidental cure. So we have to understand the whole concept of the biological terrain, our innate immune system, and understand the matrix of life force and the meridian system, understanding the ancient, authentic acupuncture meridian system that has been known for thousands of years. It's just another case here. Physician with adrenal burnout, Lyme, breast cancer, and when you look at the DNA test, there are all kinds of microbes out there, dental parasite. Not only that, Lyme and co-infection hidden in the tooth. That's why when you treat them for Lyme, if you stop the antibiotic, symptom comes back right away. Meanwhile, we're losing time. They go at a deeper level, and the people just don't respond well. Here's a 55-year-old lawyer from California with a lung cancer met to the brain. I saw him first time 2018. Chief complaint, he said he's falling and leg feels weak, heavy numbness. It was 2017. His right lung, multiple nodules of a large mass and multiple met to the brain. He's got also, according to PET and CT scan, he got spread all over lung, brain, and bone. He had a radiation to the brain. He's got EGFR mutation, recommend no chemotherapy, but doing some immunotherapy called Glioblastomas. I'm not familiar with this kind of medication. He had a history of migraine headache, and he took the train. Took him 3 days to come from California, and because he couldn't fly, especially with the radiation to the brain. And when you look at, he's got 3 root canals that go corresponding to lung meridian. So what do? Immediately those 3 root canals have to come out and put him on multiple parasite medication. That's his meridian system. Put him on Ivermectin, parental palmoate, praziquantel, tanadazole, and then nystatin, fluconazole, and itraconazole for 10 days for 3 cycles. And anyway, so let me see here. Yeah, second visit, few months later, there's a change from the top to the bottom. And I got the report from the oncologist that all his tumor went away except there's one small lesion in the brain stem. When I see the lesion in the brain stem, it's usually residual dental infection from trigeminal lobe. Dental infection will go to the brain stem by the pons. But they decide to do, at that time, immunotherapy. He responds so quick, so fast. They decide to do immunotherapy, and next thing I know, I got the memo saying he passed away. I'm not sure whether I could truly help him. I'm just to rebalance the meridian system. And he also have a high environmental toxins, heavy metals, and the allergy problem. So progression, you have to go through monitoring it. But when somebody is so far away, it's hard to have a follow-up, and always looking for some simple solutions. And in his case, he didn't make it. but I'm just giving you as a case study. So these are some of the statistics based on CDC, WHO from the mainstream. Oh, these are all the statistics. The statistics doesn't change. Billions of people are infected. Millions of people are dying from parasite infection. I'm not going to go through this, but this is based on standard tests. What they don't tell you is how many people are dying from asthma, COPD, cancer, and all those other problems. Maybe there's an underlying problem with parasite problem. It's not part of this statistics. Just give you the magnitude of the problem. Viral infection itself is not as of a bigger impact. It's the parasite give a much greater impact of what's going on. So why parasite problems are overlooked? Because we think parasites only for third world countries. I've been to Europe many times. I've been stationed there for several times. I did treat civilians, European, NATO soldiers, besides American soldiers. Guess what they have? They all have a parasite problem. But they don't come as a parasite problem. They come as a irritable bowel syndrome, as a maybe Crohn's, or they may have asthma or multiple sclerosis, or migraine headache. Many of them respond to parasite medication. And there's a worldwide global migration and change in diet, global climate changes. What don't expect in northern, northern Wisconsin, they will see schistosome, the liver flux. Stool analysis of parasites is simply not a reliable test. I don't do it anymore. I do trip-based meridian tests. And often these parasites are outside the intestinal tract. It's in your brain, it's in your lung, it's in your pancreas, it's in your muscle, it's everywhere. And when you have a dog, cats, and other pets, that the vector bring the parasite into your home. And there are so many other cofactors, environmental pollutions and nutritional status will make you more vulnerable to have a parasite infection. And parasites have a complex life cycle and ecosystem. They're very difficult to kill. I don't have a 100% success rate. I'm always found a new way to treat cancer, and they have a different life cycle. We have to change and modify. And so many people are from out of state, sometimes out of country, and it's hard to monitor these people. And they're engaged in what I call molecular mimicry and have a biofilm to make it very difficult to treat. So parasites are true polymorphic microorganisms that can be actually 30 feet long, can be very small as a single cell, and they have their own community of ecosystem. So we can divide the parasite into protozoal as a single cell, roundworm, tapeworm, flukes, intracellular parasite, ectoparasite, and I think we're seeing more and more what I call synthetic biology and man-made artificial parasite. You may consider controversial topics like COVID-19. Is this some kind of a synthetic biology? But anyway, that's all controversial aspects of it. But I think we have to be aware of it. We have to be on guard. So parasites will bring their own concurrent co-infections. They bring with the virus, nanobacteria, intracellular parasite, cell wall deficiency bacteria, mycoplasma, spirochete, Lyme, prions, fungal-related mold, yeast, candida, genetically modified biological warfare microbes. And this is the bottom is called social, political, economical, emotional, and spiritual parasitic relationship. That's also some of the very sick people. They have to get rid of that parasitic relationship. That can be your husband, it can be your wife, it can be your job, whatever. So there are multiple signs of a parasite. I'm not going to go through all those, but it can cause allergy problem. It can suppress the allergy problem. If you have the parasite problem, it can give you a leaky gut, cause a lot of allergy problem in the beginning. But if you have the parasite problem for 10, 20 years, you have a suppressed immune system, and you may not see any allergy problem, although I suspect there is an allergy problem. It can create a cyst, tumors, the whole list of the problems. These are cases based on a real patient case who respond to parasite medication. So this is what I call parasite and mind control. Sometimes we are clueless and trying to be happy. And this parasite will control your mind not to take parasite medication. I like to remind them they will control your mind to not to take it. So you have to go through the Herxheimer reaction, but push it through it. PET scan, 10% positive, 10% false negative. So you cannot rely on PET scan alone. And chronic bacterial and parasitic infection and cancer. This is from literature review from top university. It says Salmonella has been associated with a carcinoma of gallbladder, hepatobiliary, pancreatic, lung, colorectal cancer, chlamydia, carcinoma of lung, ovary, ocular lymphoma, schistosome associated with bladder cancer, cervical, colorectal, liver cancer, liver flu, cholangiocarcinoma, chronic osteomyelitis, myeloma. One of the most common chronic osteomyelitis is a jaw infections. Can associate with multiple myeloma, fibrosarcoma, and angiosarcoma. And I mentioned about the fusiform bacterium from dental infection has been also associated with the lung cancer, colorectal cancers, and the list goes on. Parasites mimicking malignancy. Sometimes they go in to have an operation only to find out it's a brain tumor, or it could be a spinal tumor, duodenal cancer, pancreatic cancer, turns out to be is actually a parasite. Probably the most well-known case is right now that there was a brain tumor, one of the important politicians, turned out to be also actually parasite in the brain. So look at from here, the ivermectin. I've been writing about ivermectin. I wrote a called ivermectin deficiency syndrome. It's not only good for parasite, like of a strongyloid and liver blind parasite, but it says ivermectin inactivates the protein kinase PAK1 and blocks PAK1 dependent growth of human ovarian cancer, and they need that for cancer to grow. 70% of human cancer need the PAK1 kinase for pancreatic cancer, colon, breast, and prostate cancer. So if you have this cancer patient, it's safe to say put on ivermectin. People tolerate very well, hardly any problem at all. And it's also known to be good for COVID. But also look at from the second line here, it says ivermectin represents a doubly anti-beta catenin signaling pathway by bonding to etc. here, indicating this ivermectin, niclosamide, downregulate doubly anti-signaling pathway. So I think parasite have a dual function. Not only is go after the parasite, but also have effects on doubly anti-signaling pathway for reducing proliferation and migration, and for repair. So maybe that's one of the reasons why people respond. I couldn't figure out why these people respond. So many problem goes away. Only one that do not respond is if you have an active dental infection, you need dentist get to pull the bad tooth out. And when you have an environmental toxin, it has to be detoxified. Albendazole affects on microtubule for cancer cells. It can go up to 2,400 milligrams per day. Praziquantel decrease biliary periductal fibrosis and great for cholangiocarcinoma. You never use this as a single agent. Use in combination with albendazole, ivermectin, mebendazole, or praziquantel together with a niclosamide with an anti-fungal medication. Antibiotics. Azithromycin target mitochondria, effectively eradicating cancer stem cells across multiple tumor types that can be breast, ovarian, pancreatic, lung, brain, prostate, and melanoma. That's published in University of Manchester 2015. So if you see some of the parasite medication I use, I do include sometimes azithromycin and doxycycline as a part of it, targeting for cancer stem cell. Anti-fungal medication, itraconazole, is also an cancer agent for basal cell carcinoma, non-small cell lung cancer, prostate cancer, and also these antifungal medications also control the WNT signaling pathway. It will downregulate. Here's a 67-year-old man with a soft, hard palate, oral cancer. Recommend radical resection of the jaw, protrach, feeding tube, and chemo and radiation. You can see that part of your tumor there. He didn't like the option. He went to MD Anderson, same recommendation. So I checked the Meridian system. That's the first thing I do. And guess what here? Dental is the only one picking up. Those are two blue bars, is a dental-related problem. So what do? I check dental x-ray, panoramic view dental x-ray. And he have 9 root canals, and the entire tooth has been worked on. So what do? I tell them, you have to put all your teeth out, and you have to wear full denture. When I say this, 20 years ago, patient never come back to see me. But after you lose so many patients, you build some reputation and take my advice more seriously. And he put all the teeth out, save his face, he's wearing a full denture, and he can see him in eating McDonald's hamburgers. At least he can chew. He may not be able to eat steaks, but he can eat hamburgers without having any problems. Here's a 3 brain tumor case, Glioblastoma multiforme. I wrote this article a couple months ago, connecting parasite, dental parasite. I have a 65-year-old oncologist from Washington State. He had a craniotomy, chemo, radiation. Second case is a 46-year-old Canadian, serous post craniotomy, chemo, radiation. 61-year-old with a serous post craniotomy had a complication for E. coli infection. He had a second and third brain operation, no chemo, radiation from Michigan. Common denominator. They got the dental work done very next day, 2 days later, but within a week. First patient got it. Now, this is all the Meridian tests. And everybody have a little bit different reading, so you have to treat them slightly different. The first one is the oncologist, 4 tooth came out within few days. The second case is Canadian. The baby tooth never came out, is in fact had to come out very next day. The other one have 2 tooth came out. They all came out. When that tooth is coming out, I know they have a better chance for survival, and their living far exceed the life expectancy for glioblastoma multiforme. And here's a Canadian case. She got first diagnosed year 2022. After the craniotomy, chemo, radiation, guess what? If you don't correct the underlying problem, tumor comes back. That was April 2023, and I saw that year 2023. That's a brain tumor there. And 1 year later, I've been treating her with a parasite, antibiotic, antifungal medication. And 1 year later, shrinking so quick, so fast, I couldn't believe it is possible. She's in Canada. I saw a few times in between. And before she couldn't talk, I thought she acts like a stroke patient. And now she's speaking fluent French and perfectly normal looking. 1 year of a continuous parasite and fungal medication rotating. Now, I wish I can stop the story here. That was in May when I saw her. And I saw her back in August. She still looked great. So I said, but we're not going to stop the parasite fungal medication. And then I got a phone call from her husband. She fell, hit her head, and a few weeks later, she's more confused, unsteady. Check the scan again, the cancer right back. It's inflammation triggering it. I just saw a week ago, and again, she's not in good shape, and I told her to take parasite and fungal meds all together, and we have to adjust the parasite medication, and I told her to do chemotherapy. That's the best chance she has while she's on parasite and antibiotic and antifungal medication. But just give you an idea, from that to this, with a continuous anti-parasitic, antibiotic, and anti-fungal medication. Many people cannot handle this. They say, well, antibiotic will be so bad on your microbiome, but if you need it, you need it, because these antibiotics go after cancer stem cells. So change from the top to the bottom, it took about a year. And when I saw it in August, it looked good. And I don't have the latest report, but again, she looked almost like as bad as the first time after it hit her head. So these are the parasite-fungal medication. Ivermectin, 12 milligram. Typically TID, QID, typically I would put on 2 or 3 weeks. Mebendazole, you can switch to albendazole or fenbendazole, some of the people hacking system. Parasite-Fungal, 600 milligram, niclosamide. And then we'll switch to azithromycin, tanadazole, nystatin, and followed by doxycycline, fluconazole, and itraconazole. At least we'll go through the rotate, and if tolerate, if somebody is poor prognosis, sometimes I'll combine them all together if they can tolerate. That's not the only one I use, but this is what I use the most. Sometimes I can use Alenia, I use levamisole, and different kind of medication. If I have excess, sometimes I will use called 3-bromopyruvate. And these are more the natural remedies for parasite. I do use in conjunction with the natural parasite remedies with parasite medication, including like mimosa, paducah, MMS, chlorine dioxide, turpentine. One patient had a 40-day fast, but as a rule, they're not as strong as a prescribed medication. Briefly on diet, typical the cancer patient, I put them on 50% fat, 30% protein, 20% carbohydrate, and selection of the food is based on allergy test and blood type diet. Relatively high fat, high protein, low carb, but I don't push it for ketogenic diet. That's be too hard for patient to follow for sustaining time. But this is good enough to see patient. I can turn this patient around for many cases. And detox, I'm a big fan of a cleansing detox. All cancer patients, I make them to do gallbladder liver flush. Sometimes they're past the size of the marble size or golf ball size, gallstone will come out. And typical cancer patients, I make them to do once a month for at least 6 months to a year. That's a typical, sometimes more frequently. This is the last case. 72-year-old man, stage 4 lung cancer, incidental pre-op hernia operation. He's from Chicago. Met to the coracoid bone, multiple lesions, non-small cell carcinoma per biopsy, and chemo radiation recommended. Family say, we're not going to do chemo radiation because the prognosis is very poor, even with the chemo and radiation. Look at the meridian system. I know he's got major dental problem, lung, and allergy immune system. Now I want you to feel comfortable. This is my last case. Using ivermectin, praziquantel, Alenia, mebendazole, itraconazole, fluconazole. Look for heavy metals. He's got high in lead, mercury, antimony, arsenic. He's got multiple root canals and infections to the jaw and cavitation. He had an insulin potentiation therapy for 34 times. And eventually he looked stable. About a year and a half, 2 years later, he looked stable. They reassessed at the University of Chicago. And they said, I think you are stable. Before that was inoperable. And they removed the part of the lung mass. And look at this here. Here the lung mass, 4.6 by 2.5 by 2.1 centimeter mass, poorly differentiated adenocarcinoma of the lung. But within that mass, there's a coccidiomycosis, fungal infections. So that's what I'm pointing out. You have to go parasite, also fungal and antibiotic. We have to go through the process. Now I think he's got 10 PET scans. This is now about 10 years later. He's about 81, 82 years old. He's robust. He's in good health. This is a long term because we didn't do chemo, correct the underlying problem. So that's my last case study. And so this is end of my lectures. And there's one last slide I'd like to show you, just in case you're not familiar with the globular therapy. This is what I call ancient intelligence. Acupuncture has been known for a few thousand years. Now, when you talk about globular therapy, they talk about maybe 12,000 years or far more than just a few thousand, going back and back. Somebody taught acupuncture system. Maybe there's another civilization that we didn't know. So we have to look at ancient intelligence much more trump artificial intelligence. So this is my end of the talk. Thanks for listening, and I will open up for questions and the answers.